The state is implementing a new tool to fight the opioid epidemic. Mobile clinics. They drive across the state to provide treatment to those in need. A possibly life-saving effort for people living in more rural areas where options for health care can be few and far between. Now, it's a pilot program right now that got off the ground because of grant funding. You see it here. They're small, but they're fully equipped clinics with an exam room and testing materials. The state's attorney general understands rural counties have unique challenges, and the mobile unit is one answer. And one mobile unit operator who once needed similar treatment says having something like this will indeed be life-changing and life-saving.
There are creative solutions being identified and deployed all across the state.
It's an epidemic now, you know what I'm saying? It's everywhere. You can't ignore it, so why stigmatize it? Like, if it's your kid dying, you know, I think it would make a difference.
Data shows 11 North Carolinians die from overdoses every single day, and even more people are heading to hospitals. Look at the number here. There have been more than 9,500 such emergency department visits in just the last 12 months. This is a war that is taking a costly emotional toll, and it's also an incredibly expensive one. More than $50 billion. That's how much the prescription opioid industry has so far agreed to pay state and local governments. That's for settling numerous lawsuits in the wake of the overdose epidemic. But as our national investigative team and KFF Health News found, it's not always clear how that money will be used. Here's investigative reporter Carice Jackman with more of her story, Payback.
Everywhere you turn in Jacqueline Lewis's home, you'll spot pictures of her son, Sean.
He loved taking care of his family, and he had a heart for people that were broken because he felt broken.
Broken because for 20 years, Sean battled substance abuse.
I just watched him every day get up and fight to live. He was fighting just to live.
For 2 decades, Sean battled addiction, but that ended in October 2022 when he died of an overdose. At the time, his daughter, Ava, just 7 years old.
I have to watch her on days where she's curled up in a fetal position crying, wailing, because she wants her daddy and he's not here.
After losing her son, Jacqueline is now raising her granddaughter. An overdose also took Ava's mother's life. 2 parents' deaths impacting the life of this little girl. Sean's substance abuse centered around opioids, the class of powerful pain-reducing drugs responsible for the majority of overdoses, sometimes prescribed by doctors, but often bought and sold illegally on the streets or online. According to the Centers for Disease Control and Prevention, more than 500,000 people have died of drug overdoses involving opioids since 2010. Sean was originally prescribed an opioid for scoliosis pain.
In middle school, the doctors started prescribing him pain medications. We didn't know they were addictive at that time.
Stories like his have fueled thousands of lawsuits against opioid manufacturers, distributors, and retailers. So far, those lawsuits have resulted in industry changes and more than $50 billion in settlement dollars that will go to state and local governments across the country. But after that, exactly where that money is going can be difficult to pin down. Governments can offer greater transparency, but our partners at KFF Health News and an attorney at opioidsettlementtracker.com found few efforts to do so. According to their analysis, only around 1/3 of states have promised the public detailed reporting of where millions of dollars are going. Diana Fishbein is a professor and researcher at the University of North Carolina. She and other experts say one of the best investments communities can make with the settlement money is in youth prevention, starting early and addressing the root causes of addiction, such as trauma, food insecurity, or lack of access to health care.
Historically, it's been dramatically underfunded and underappreciated, and that contrasts with the data that's been amassed in prevention showing how potent it can be.
But what researchers suggest isn't necessarily playing out in reality. When Investigate TV and KFF Health News look for examples of how local governments are approaching youth prevention, we found multiple examples of settlement money going to a program that's been criticized in the past.
Now we're say no to drugs.
The Drug Abuse Resistance Education Program, or DARE, emerged in the 1980s, with law enforcement educating kids on resisting drugs. But studies in the 1990s cast doubt on whether DARE actually worked, and now some critics question whether that money should be going to the program. DARE reworked its curriculum in the early 2000s to address the concerns.
It's more student-based than instructor-based. Is one difference.
Instead of framing drugs as a scary thing for teens, Francisco Pagueros, CEO of DARE America, says the new program includes the students in the conversation, like role-playing, and talks about how their decisions will affect their health and families.
Do you think this is a good use for the money?
Yes, it can be, if it's approached correctly. If you're looking to just spend money, it's not going to be productive.
Was her favorite shirt he wore. So
Back in Ohio, Jacqueline says she worries the money won't be as productive as it could be, and she's been pushing for caregivers like herself to have a voice. But Ohio is one of the states that has been criticized for not including the public in the conversation.
my concern is that none of this money is going to go help impacted families.
So far, governments have received around $3 billion of the more than $50 billion in settlement dollars that will be paid out by opioid manufacturers, distributors, and retailers over the next 15 years.